Hello and welcome to today's webinar on digital therapeutics for cardiac care. I'm Pat Dunn from the Center for Health Technology and Innovation, and I'm honored to serve as the moderator for this important discussion. As we know, digital health is transforming the way we deliver care, especially in cardiology, where innovative technologies are enabling more personalized, accessible, and effective interventions. Today's conversation will explore how digital therapeutics are shaping the future of cardiac care and improving outcomes for patients around the world. This webinar is also an opportunity to highlight an initiative that I know is very close to many of us: the Digital Health Professional Training Modules and the Digital Health in Cardiac Care certification that we have developed at the American Heart Association. These resources are designed to equip healthcare professionals with the knowledge and skills needed to navigate the evolving digital health landscape and integrate these tools into practice effectively. I want to take a moment to recognize all of our panelists who have played a significant role in the development of these modules. Your expertise and dedication have been invaluable. I'd also like to extend a special thank you to my colleague, Rachel Charbonneau, who's not on camera, but is behind the scenes pulling many of the strings here, but whose leadership and commitment have been instrumental in bringing this program to life. We're excited to announce the next 6 modules of our Digital Health Professional Training Program. These modules focus on equipping professionals with better understanding of digital health technology and its various uses in supporting patient care in cardiology space. These modules cover various tools, methods, and skills you'll need to implement digital tools and therapeutics in patient care, including understanding digital tools and remote patient monitoring, health tech equity and SDOH considerations, communication and coaching skills to increase patient engagement, health literacy strategies, digital intervention best practices, and more condition-specific digital therapeutic considerations. These modules are designed for health care and wellness professionals of all experience levels, whether you're exploring digital health tools for the first time or refining your expertise. Modules 1 through 12 are now live in the American Heart Association's Patient Education Hub, and you can get more information on these modules in the chat. The American Heart Association is also recruiting for healthcare and health and wellness professionals to sign up and take the Certified Professional by the American Heart Association Digital Health in Cardiac Care Certification exam. After today's webinar, we will follow up with a brief survey for you to sign up. You can also find the survey instructions in the chat right now. The beta exam is offered at no charge. We only ask a few hours of your time to sit for the exam. And by sitting for the beta exam, you'll have the opportunity to preview and provide feedback on the exam content, gain early insights into emerging trends in digital health, and earn certification if scores meet the passing threshold. The exam window opens later this month. Folks from our professional certification team will follow up with you with scheduling instructions and answer any questions in the meantime. With that, let's dive into today's discussion. I'm looking forward to an engaging and insightful conversation. So let's start with some introductions. So why don't we start with Lauren and let you introduce yourself, just do a brief who you are, what you do, where you work, and then we'll go around a second time with more specifics on your role.
Thank you so much for including me in this panel. I'm incredibly grateful to be with all these amazing providers. So my professional background is in women's health physical therapy, and I am currently pursuing a professional pivot. I have a personal and professional passion for women's cardiac health. I have been helping the AHA with 2 different projects, and outside of the AHA, I have been using my clinical skills and expertise to advise a few femtech startups, US University, and also doing some work for Philips Healthcare as a medical expert for their pregnancy app.
Great. Chang, we'll go next.
Okay, hello everyone, and thank you, Pat and Rachel, for having me here. So, my name is Chang Kim. Currently a cardiac electrophysiology fellow at Johns Hopkins Hospital. Past few years, I've been a cardiology fellow at Johns Hopkins Hospital as well as a health technology and innovation research fellow from the AHA. So, I've been fortunate to be supported by the AHA to be involved in our digital health lab and the mobile technology center at Johns Hopkins. And as part of that, I was able to lead the MTech rehab trial, which is a randomized controlled trial testing basically a digital cardiac rehab, digital health cardiac rehab implementation to our patients at Johns Hopkins Hospital and our satellite hospitals. So we actually just recently wrapped up the trial in October of 2024. We presented the preliminary results at AHA scientific sessions in November last year, in the process of kind of compiling further data for their primary manuscript. So I'm excited to be here and have a good discussion today.
Great, thank you. And AJ.
Hi there, AJ Blood. I am a cardiologist and intensivist at Brigham and Women's Hospital in Boston, Massachusetts. Do a lot of research on implementation science across the cardiometabolic spectrum, as well as digital health and data science. So really excited to be here, and thanks for the invitation.
Great. And looks like we have Lani. Perfect timing, Lani. We're just doing some intros. I know you had some traffic issues, but welcome to the program. So if you can just introduce yourself.
Yes, hi. I apologize. Got stuck behind a terrible accident, but I am here and nobody wants to start their day that way. My name is Lani Reilly. I am the VP of Patient Access at the Digital Therapeutics Alliance, and I very much appreciate being here, and I very much apologize for not being prompt.
No worries. Yeah, and we'll switch up the order on how we ask these questions. So maybe we'll start with AJ. So I know you've got some amazing stuff that you've got going on. Tell us a little bit about what you're excited about in the area of digital therapeutics and cardiac care.
Yeah, thanks so much. So, my research group focuses, as I mentioned, largely on implementation science at a population health level, across the cardiometabolic spectrum. So, a lot of the tools and technologies we see have to do with remote health, ease of access. And a lot of what I focus on is making healthcare easier to provide for providers and easier to consume for patients. So, there's a lot of cool advances that we've seen, with everything from some of the patient engagement, education tools that we've seen with large language models, and the way that a lot of those solutions have been able to engage, educate, and continue to, allow patients to ask and answer questions about their healthcare. I think we've seen that best done through more validated channels, and really making some of the things like AHA guidelines more accessible, readable, and understandable, both for patients and providers. I think there's been so many things, it's hard to pick one, but advances in some of the digital monitoring tools and companies that are built around things like RPM or remote physiologic monitoring and CCM or chronic care management, really trying to address how do we get these new tools and technologies out to people, but also how do we compensate providers and health systems for doing a lot of work that's entailed in delivering that care. I think some of the, even the digital and physical devices that we're seeing, mobile EKGs, wristwatch blood pressure devices, PPG, whether on chest patches or wrist-based devices, that allow for, more regular, continuous, non-invasive monitoring of health metrics. I think as we're able to, one of our challenges, and I'd say one of our charges as healthcare providers, is how do you actually take all that data that's out there and integrate it and synthesize it into a care plan that makes sense for a patient, and then not only just say, hey, here's your plan, I'll see you in 6 months, but do a much more comprehensive job than we've really been able to do before in engaging with our patient and holding their hand every step of the way, and having the right tools and technologies to enable that type of really seamless integration of a patient's life with their healthcare, I think is something that I'm really excited about. And I think there's a lot of tools and technologies that are here and are emerging that are going to make that possible.
Great. Lani, what are you excited about?
I think that agree with everything that Dr. Blood just said, but one of the things that comes to mind for me as my focus is patient access and patient education at the Digital Therapeutics Alliance is really bringing patients up to speed and really helping them understand what these digital tools will be able to do for them across their journey of care, and closing that, gap where we have patients that can access more easily the care that they need, with patients that have, lots of blockers to accessing the care that they need in terms of, geography or whatever that might be. So, my excitement around digital therapeutics in general is bringing that gap to a narrower place, because now it's, as we know, it's wide. There are a lot of folks that have a lot of difficulty accessing care. And I'm excited that digital therapeutics can really make a difference in that space. And that said, the comments that Dr. Blood made around, integration with, our clinicians' workflow and helping patients to understand what they need to do to access these tools. That's a lift, and we still have a lot of work to do, but that's definitely what DTA is here to support. So I'm excited about being able to do all of those things. And it's a lot of work, but we'll do it.
Chang, I'd love to get your thoughts not only on what you're excited about, but in your specialties of electrophysiology and with rehab, there's already a lot of tools, and there's tools for patients. There's also tools for the professionals. So, tell us a little bit more about the work that you're doing and the stuff that you're excited about.
Yes, thank you. So I think, as our previous panelist has mentioned, I think the keywords of integration and implementation are basically what I am excited about. And I feel like there's a lot of work to do for us as kind of healthcare providers in providing that for our patients. So first of all, the integration part. So as you mentioned, there's nowadays a lot of technology, sensors, and basically data collection tools that patients can either initiate on their own or can be prescribed by the providers. And but the key part comes down to how do we again integrate the information to develop a personalized care plan for each and every patient. And I think the integration technology piece is also kind of getting there. In terms of what I've worked on in the past and what I'm seeing now in electrophysiology, in the cardiac rehab space, we used an integrating technology platform developed by Corey Health, where basically it's a smartphone application that integrates data from a smartwatch and then a Bluetooth monitor, and also a various kind of health coaching sessions that collect additional data, and it can display that on a dashboard for patients and also for providers to help integrate that into basically develop these personalized health coaching type of sessions for intervention. In terms of implementation, now we need these clinical studies to get it, get those results and prove that certain interventions and combinations of interventions can have a clinical effect, and then bring it to actual clinical practice. That's obviously an ongoing work. And for the trial that I worked on in the past few years with the digital cardiac rehab, we had been doing that. And in terms of going forward in the electrophysiology space, there's a lot of excitement about how smartwatches and how their arrhythmia detection capabilities. We're also kind of seeing some traction in terms of integrating sleep apnea testing and other risk factors that can lead to arrhythmias, and kind of actually pulling all those things together. And I think again the key point being integration of all the data that we collect from these various technology input points. And I'm excited to kind of take part in that journey from finding out about the technology, integrating it, and moving it forward for implementation.
And Lauren, you have unique expertise, not only as a physical therapist, but then also focusing on women's health. So tell us a little bit more about the digital therapeutic opportunities in that space, and the things that you're excited about.
Thank you. Yeah. So like you said, I'm incredibly passionate about women's cardiac health. And so I think one of the biggest things that I'm excited about for digital therapeutics is helping to create more data to potentially close the gap in women's cardiac health and better inform healthcare decisions for women. I'm also really excited about the potential to have it be a delivery source for really credible evidence-based education, because too many women don't know enough about their heart health. And then I'm also really excited about its potential to really promote preventative strategies like helping patients have better experience and engagement and compliance with behavioral and lifestyle changes. I think that that's going to be a really great way for us to go forward with trying to get better compliance with those treatment strategies. And I also think it's a great way to improve our access to care barriers with so many issues with both cardiac and maternal deserts. I think having these digital opportunities will be able to connect people that may not be able to be connected with these really well-established or knowledgeable healthcare teams.
Great. Lani, I'd like you to start with this. Maybe if you could teach us a little bit about what digital therapeutics are and how are digital therapeutics different or not different than just other therapeutics or other non-digital things that are out there?
Sure. Yeah, that's absolutely something I can do. So a digital therapeutic is something that is very specific under the larger umbrella of healthcare technology, right? So a digital therapeutic is software as a medical device, and the software itself is what is providing the intervention to the patient. So we need to think about that first. It's specific because, it is not a drug. It is not simply an RPM tool. RPM might be part of a digital therapeutic, RTM, or, remote physiological or remote therapeutic monitoring. Those things may be part of a digital therapeutic, but the software must deliver the intervention to the patient, and it must have a positive demonstrable outcome on the patient's outcomes. So that is, a digital therapeutic. And as you can see with that definition, it's narrower than you might expect. I mentioned a minute ago that digital therapeutics, we have a ways to go in terms of awareness. And when I speak with patients and do patient education, there's still some conflation, right, between what is perceived as a digital therapeutic, but might be just a monitoring tool. Or, I asked the question in a patient roundtable not too long ago, has anyone used a digital therapeutic? And someone raised their hand and said that they had, and it was more about, monitoring symptoms, which is okay. Like, all of these things are wonderful. All of these things are helpful digital tools. But when we think of a therapeutic and its very specific definition, it's the software that has to deliver that care. So these tools are also regulated by the FDA. We don't need to get into, the specifics of how. There are a couple of pathways that, regulate these tools. And again, different from, but complementary to sort of the larger spectrum of digital healthcare tools and virtual care in general, right? So some of our digital therapeutics manufacturers do deploy, for example, telehealth to help support the use of their tool among, their patient population. So hopefully that's helpful.
Yeah, and the distinction, so Chang, maybe if you can tell us a little bit about maybe the distinction between the hardware and the software. I have a personal experience in the case of AFib. I'm kind of a tech geek, so I've got all of these tools and devices I play with. And about 2 years ago, my devices all of a sudden started telling me that I had AFib. I found it a little bit of a disconnect then trying to explain that back to my own personal physician, who was pretty dismissive that, hey, these things aren't very accurate and, really no need to worry about it. But guess what? I had AFib. So any thoughts, just again, from a rehab, but also from a arrhythmia detection standpoint?
Yes, I think there's basically been a lot of progress recently in terms of the accuracy of these wearable devices in arrhythmia detection, and a lot more kind of clinical validation studies too. Of course, if you're talking about an Apple Watch, they led the study with the Apple Heart study, and the accuracy is actually very, very good. If you have basically an arrhythmia alert, and you follow up with follow-up testing on a clinical grade arrhythmia monitoring tool, I think the positive predictive value is above 85%, I think. So it's a very good kind of a screening tool at an individual level. In the EP, like arrhythmia clinics, like we have patients like self-motivated patients who come in with something like that. Hey, my smartwatch kind of detected this arrhythmia for me, and a lot of times they are actually going over these basically single lead recordings of their rhythm, and there are times where the watch is basically it's detecting noise, but there are definitely times where we are this looks like AFib, but let's verify it using again a clinical grade monitoring tool. So we do take that into account, and once the diagnosis is established, such as atrial fibrillation, then monitoring the burden on how much of arrhythmia are they actually having, it's actually very, very useful, because one of the things about a wearable device is that you could actually wear it almost all day long, close to 24 hours, as opposed to and for however many days you want, right? As opposed to like something like a wearable patch monitor that you were wearing for a week or two, and then that's it. So in terms of, especially for paroxysmal arrhythmias, where it's only happening very occasionally, it's very, very useful to monitor a patient's burden over the long term. And in terms of like how that impacts management, in terms of, let's say, atrial fibrillation, the most recent thinking is that beyond just the diagnosis and categorization of paroxysmal or persistent or long-term persistent, we're actually taking into account more and more the burden and the patterns of arrhythmia. So I think in that sense, these the consumer grade wearables will add a lot to our understanding going forward as well.
Awesome. And maybe we'll have AJ and Lauren kind of share this question from a clinical medicine perspective and from a rehab and therapy perspective. But AJ, I know you've done a lot of work in RPM, but how do you integrate RPM into a clinical practice? So now you're a practicing cardiologist or even a primary care physician. You've got all these data points coming at you. How do you actually integrate that into your practice effectively?
Yeah, it's a great question. And I think there are a lot of tools and technologies out there as well as, even companies that can layer on additional points of support, which I think are really necessary. Because I think one thing I like to highlight is like, I need another data stream or another portal to log in, or another, external source of information. Like I need another hole in my head. It's
you're not busy enough already, right?
Right. And again, it's not that I don't care about this information, because I do. There's good data that, ambulatory monitoring, captures, mass hypertension, frequently. There's a lot of people who have a normal blood pressure in clinic. They're actually elevated at home, and those patients are at elevated risk. And if you don't identify that and appropriately, counsel and treat those elevated blood pressures, you'll be missing out on opportunities to improve health metrics for patients who are at risk. So I think the information is really important. What I do think it needs to have around it is some sort of support. So it either needs to integrate into the regular workflow of a provider or practitioner in some way, shape, or form. Or it needs to be a standalone solution where clinicians are only engaged when there's really something clinical to act on above and beyond what can be done by an automated system. So a lot of our research is, focused on using collaborative drug therapy management programs and really empowering pharmacists to make medication changes and titrations when it falls under an algorithm designed and agreed upon by a physician. So I think that those types of models do make things scalable, and it doesn't get to the point that every time a blood pressure reading comes in, automatically a doctor is paged. I think that's the type of system that we want to avoid. And I'm sure, as Dr. Kim would, mention, recapitulate, like every time, we get, that night and weekend page, it's just like one more, needle to the haystack of burnout that, a lot of providers are already feeling. So I think those are the two, must-haves, when it comes to some of these solutions around RPM, CCM, whatever these types of tools or mechanisms are. It can't be interruptive. It really should be, either team-based or system-based, such that there are ways to manage this in a comprehensive way, and it can't be completely external to the workflow of any individual provider or provider team, because layering on additional mechanisms through which we have to interact, engage, answer questions. I don't want to show you my Epic inbox right now, but I'll tell you there's plenty that I have to address already. And there's a lot of different ways that we can make this easier for providers and for patients. And if you're making it actually harder, or you're adding additional asks of me, my time, or that of my team, we're not going to be friends. And I want to be friends.
We want to be friends. So Lauren, my son is a physical therapist, and he reminds me that physical therapy is very hands-on. You don't need a cloud, you don't need all of these fancy things, because you're there, you're touching the patient, and you're doing good things. So how do you integrate a digital therapeutic into a physical therapy practice?
I think that's a great question. So I think a digital therapeutic is a great way to measure a baseline, to kind of see where you're starting. In certain protocols, there are, heart rate targets. And so it's helpful for patients to see what their heart rate is doing. It's helpful for patients to see what their heart rate is doing with response to exercise and also rest, and seeing the appropriate response. I do think that with a digital therapeutic in the setting of physical therapy or any kind of rehab, there needs to be some kind of education that helps patients kind of understand what is normal. I think there are some patients that don't quite understand that, with exercise, your heart rate should go up and then it should come down with rest. I think some patients get quite alarmed by the rise in their heart rate. But to Dr. Blood's point, I think one of the benefits could be to having a digital journal to kind of help patients put like a bigger context to what's happening with their vitals, and kind of better understand it, like putting in whether their heart rate is changing with rest or with stress or with exercise, and giving the provider just like a better picture as to why the changes are happening, so that it's easier for the provider to respond in a way that's appropriate, and then also to decide, is this something that's like needing an emergent response.
So Chang and AJ, you both mentioned some concerns. One, just frankly, the accuracy of the data. The other is just what it does to the clinical burden. What are your, are there additional concerns or challenges with how to implement this into, and we'll subdivide this into, the clinical, and then for Lani and Lauren, more into the OT and PT space. What are some other concerns that you have about really making this something that can be adopted and used, not just by leading edge people like yourselves, but by the majority of healthcare professionals?
I'm happy to jump in. So I will say, kind of one of the elephants in the room is the kind of current, administration and regulatory environment. I'll say, we're already starting to see some downward pressure on a lot of the, advances that we made out of COVID, with access to care, digital care, remote care, telemedicine and telehealth. I would say, while, we have this vision that digital technology is going to democratize access, and we're going to, be able to improve outcomes by, enabling, patients and providers to engage more deeply, more regularly. If there's not, financial models that support that, it's really hard to scale it. And we've seen that kind of time and time again, especially across preventative care, because it's not something that, I think the Ben Franklin quote is, "An ounce of prevention is worth a pound of cure." We haven't learned that from a financial remuneration strategy in the economics of healthcare as it currently stands. So I think we're stuck in a model of still largely fee for service, and when you've got a lot of leaders in politics and CMS and FDA and other places that are touting healthcare is not a right, and it definitely casts a pall over a lot of the advances that we've been able to make, and I think you know, even with some of the large conferences going now, you know, HIMSS and some others, I think, you know, exactly what the regulatory environment is going to look like, what the reimbursement environment is going to look like, the role that CMMS is gonna play really in leading a lot of these changes. We've been, you know, fortunate to make a lot of good progress and I think accelerate, you know, digital health adoption, innovations over the course of the past couple of decades with a few silver linings of the COVID pandemic. I'm nervous about that continued trajectory and that continued strides that we've made towards improving population health with a lot of these tools and technologies because of the environment.
Chang, from the again, you mentioned the accuracy. So we have, there could be a false positive, which is just frankly adding to the burden. But what about the risk of false negatives? That the device actually isn't detecting something that it should be detecting. Does that concern you at all?
So I think we're definitely dealing with a lot more false positives and false negatives. The type of patients that would wear on their own volition these type of kind of wearable devices are the ones that are worried about something. I think I'm feeling something, so I got this device, wearable device, and this is what it's showing. So what does this mean? So that's usually the kind of the context of the discussion for these type of things. The false negatives would you'd have to have a patient or potential patient who's wearing something and is not detecting something. But then, our baseline, right, our clinical way of detecting arrhythmia is actually based on symptoms and, and like a clinical presentation. So you wouldn't necessarily be, worried about not detecting a disease that wasn't presenting clinically. In fact, the flip side of that problem is that, we have a lot of cases where the patient may not be feeling anything. So it's not clinical, not symptomatic, and yet the device is telling them there's an arrhythmia going on. There's actually some debate about what do we make clinically, of what to do about these device detected, what we call subclinical atrial fibrillation and other arrhythmias. So there's actually some debate about how to categorize those and treat those. There's some trials out and studies going on to address that question. So I wouldn't necessarily worry too much about a false negative at this point, based on at least from an arrhythmia side of things. But the false positives and how to kind of counsel patients through that would be the main issue today.
Back to my AFib story, I was completely asymptomatic. I never would have known. And we all know where the sequelae of atrial fib could lead. So thank goodness my devices picked it up. Lani, what are some of the challenges that the DTA is facing in this space?
Well,
we have a couple hours.
Exactly. Where to begin? I mean, we see, we do see headwinds for sure, but we also have seen some wins over the past year or so. To pick up on what Dr. Blood was just speaking about in terms of some concern around, the pressure we're feeling with the administration change, that's very true. But we also just had a policy update this morning at DTA, which I was listening to while I was stuck in traffic. And one of those kind of mini wins is that we've had a piece of legislation out there on the Congress floor for the last few years called the Access to Prescription Digital Therapeutics Act. And that is going to be reintroduced in this new Congress this year. So that's exciting. Yeah, little tiny things. And then we also had some, and I'm not sure if anybody mentioned this yet, I don't think I heard it. We had some codes included in the physician fee schedule this year that have to do with mental health devices. So the PFS called them DMHTs, digital mental health treatment devices. And so there are some new codes that allow for the provision of these devices, as well as for providers being able to bill for their time using them with the patient. And I know that's not specific to cardiac care. And anytime we're managing maybe a chronic disease, we also may have, right, co-occurring anxiety, co-occurring depression, co-occurring mental health issues that may be supported by a digital mental health therapeutic. So that's exciting. Again, small wins and definitely some headwinds. The last thing I'll say about, kind of the reimbursement landscape overall is that there's nothing cohesive yet. So, right, I mentioned that the PDT bill is being reintroduced. I mentioned that CMS did include a few codes in the new physician fee schedule, and that still really requires, innovators who are making these solutions to kind of piece together how they're going to get these solutions paid for. So there's nothing, there's not a benefit category. There's, nothing that's holistic in the approach in terms of reimbursement. So I say that's kind of the thing that we need to work on first in order to provide access to patients to these types of devices. So,
Lauren, what about challenges in getting patients and consumers to adopt these tools? I can use my mother as an example. She's self-described as very low tech, yet I can't get her off of Facebook. She's posting pictures, she's buying things on Amazon, she's booking travel online, but I can't get her to track her blood pressure. So what are some of the challenges in getting patients to actually adopt these tools?
Yeah, I think that's a great point. I think there's two big challenges. I think first is just education. I think the education level could be higher for many people, and as with respect to just like general health literacy as well as digital literacy. And I think in today's world, it's challenging sometimes to find the right education because there's so many different sources that are coming at you all at once, and it's hard for the average person to kind of tease out what's actually evidence-based or accurate. So I think that is one of our biggest challenges. And I hope that with digital tools coming to the forefront, I hope that all of our healthcare degree programs can include some work courses on like how to support providers and just the general public and understanding these tools and just better ways to improve health literacy. And then I think the other challenge is just that preventative strategies, which we're hoping with all these digital tools is possible, are hard for people. They're not like it's not a easy, quick fix. You have to buy into why you are being prescribed these preventative strategies. It takes work, it takes commitment, having tangible goals as well as potentially like the right support system is necessary for patient success. And sometimes I think that can be challenging. So I think that those two, as far as clinical perspective, are the biggest challenges that I see.
I think another challenge is the data, or in some cases the lack of data, that these programs actually are effective and beneficial. So AJ and Chang, you both mentioned research studies that you've been involved in. Maybe if you can mention just your belief in the importance of actually doing the research and actually having the data. We'll start with AJ on that.
Yeah, it is a challenging environment, because I think, especially as clinicians, we like to see the data, right? And we've been, the reason is we've been fooled before, right? Things that make sense pathophysiologically, biologically, has been shown to cause adverse outcomes. I'll call out, I'll use one of the fields of my colleague. We used to think, suppressing the PVCs after a heart attack, let's get rid of them. The PVCs are bad, they're dangerous, they're scary. We did that for a long time without evidence. We did the trial and we showed that was actually killing people. So, there's a reason we have trepidation before jumping with both feet on a new innovation or strategy or medicine or device or technology. So, it is challenging because that means you have to generate data, and generating data often involves conducting trials, and trials can be expensive, logistically complicated, time consuming, and it might not show you what you want to see. So, while I think we're stuck in a world where the data drives the practice, I think it's for good reason. It's for the benefit of patients. It's for the comfort of providers. And I think that it really does, even if it's something that seems like of course, that makes sense. That should be it's not always an aha moment. Sometimes it's a duh moment, but I think those are equally, important to really change practice. And so for some of the studies that I've done, I'll just talk about most recently, we developed a generative AI tool for clinical trials. We use it for clinical operations and even financial operations now. So, it's something that, we believe very strongly, this should work. It makes sense. It's going to make us more efficient. We published a retrospective study, published it in the New England Journal AI, and lo and behold, it was, it showed all the things that we wanted to show. It's faster, it's more accurate, it's cheaper. Great. But again, like that's not good enough, especially, at the ivoryest of ivory towers. Let's do a prospective, randomized, double-blinded controlled trial. And that's what we did. So we conducted and performed the MAPS LLM trial, which was just published in JAMA 2 weeks ago now. And, that was a prospective, blinded, randomized trial that showed that, yep, we can not only find eligible patients faster for clinical trials, but then also we can enroll patients faster in clinical trials for studies. So I think that was something that was, again, it's time consuming, it's personnel consuming, it's laborious, it's potentially risky. We might not have seen what we were hoping and expecting to see. But I think if you really want to change practice, being able to point to publications that show and as rigorous a clinical environment as you can demonstrate that your intervention, your new technology development tool actually, leads to better outcomes is really important. And I think that's again, you're hearing it from an academic cardiologist, so take that with a grain of salt. But and you'll see there's a spectrum of people who are willing to be early adopters, maybe with some retrospective data or with some early clinical data. But I think if you're really looking to kind of get into the guidelines, and I will say, the AHA guidelines are where a lot of people turn to get what's the next best step. What should I be doing in this circumstance? And I think, you're seeing more and more those guidelines get referenced when not only it comes to cardiology, but primary care practice. And I think those are where a lot of people, get the latest and greatest from in terms of what their practice should be. I think those are really relying on high quality clinical studies to get into those guidelines. So I think if that's where you want to be, that's the path to get there.
Great. And Chang, you mentioned you're doing a study in cardiac rehab. That's a topic near and dear to my heart. I know there's challenges, with doing those types of studies. So just maybe a comment on the challenge of doing especially an RCT in a digital therapeutic versus other therapeutics like a pharmaceutical trial.
Yes, thank you. First, I just want to mention that all the things that Dr. Blood mentioned, this challenging environment of generating clinical data and the importance of having clinical data to impact clinical practice, I agree with all of that. And then I just want to add one more piece. And beyond that, there's the cost effectiveness question, and then there's a regulatory question. Is it worthwhile, basically, even if something's effective, is it cost effective and worthwhile for a lot of patients? So that's another whole level of challenge that, I think among a life cycle of a digital therapeutic or digital health intervention, you have to go through all these checkpoints to be able to get there. So it is definitely very challenging. Now, from a clinical, a clinician's perspective, academic clinicians, and let's say we're testing these tools, I think we can do our part by helping get it through that first phase, or generating that clinical data through a rigorous clinical study. And in terms of the study that I worked on for digital health cardiac rehab, so comparing that type of intervention to a pharmaceutical intervention, there are definitely several more layers, or I should say barriers to getting that intervention implemented. So again, cardiac rehabilitation, is actually a very physical thing, right? So the main prescription is structured exercise, following a cardiac event, followed by risk factor, education and modification, and follow-up of that over time, over a 12-week period. And when we try to do for our intervention group, we are trying to implement this digital health version of it based on their smartphone and other gadgets. And I think this was mentioned before, the health technology literacy level is going to be such a key factor in implementing an implementation, right? So So for someone who's like a digital health native, it's very easy. It's like, yeah, they're already using a smartphone. They already have a smartwatch. So we'll just install the application and and then we'll just have this login for you, and then we can get going. For someone who's, an elderly patient who just had a heart attack and they're all very confused and all very worried, and they're being prescribed, 5 new medications at their time of discharge, and that, they're trying to establish with the cardiologist and trying to understand, the risk factors that go into getting a heart attack. And on top of that, now we're telling them, oh, by the way, cardiac rehabilitation is very effective, for preventing second events. And by the way, there's another technology layer that we're going to install all these gadgets and tools for you, and then you have to learn how to use all of them. It's a lot, right? So getting that technology piece, the technology orientation, took at least like maybe a third of our efforts from our study team was just dedicated to that. So we actually had a separate health tech, what we call the technology coach, just to get through the technology orientation and onboarding. And it didn't end with just the one session bedside. We used to spend like an hour and a half at bedside for each patient. They go home, they're deluged with a bunch of like discharge medications, paperwork, and follow up, and they forget about all of this. And then they realize that we have this tool. How do I use it? And there's a follow-up call, follow-up, technology. So that's a lot of extra effort required compared to, like, let's say a medication, that you just take once a day. So that's something that is definitely real in the clinical testing phase of these digital health tools. And I think we need to be all aware and recognize that, as clinicians.
Yeah, you can't just have a placebo. I mean, the reality is people in the control groups are using technology as well. So that
That's
really
true.
creates some unique challenges. Okay, we're going to wrap up really would love to know where all this is headed. So really, what is the future of digital therapeutics and cardiac care? We're going to start with Lauren, then we'll go to AJ, Chang, and we'll have Lani wrap that up. So Lauren, where is all of this going? Where are we headed with this?
Well, I hope that we're headed in a positive direction for women's health. So I'm personally working with the AHA on compiling a comprehensive cardio-obstetric care plan, which I hope to be just a landing place for a really interactive experience for anyone in the population of preconception, pregnancy, or postpartum can come to learn about their cardiac health and learn preventive strategies and improve patient ownership in their care, patient access to care, patient engagement and experience. So I am really hopeful that our data gap will be minimized through these technologies for women's health specifically.
And AJ.
Yeah, thanks again for this opportunity. I think that the future is bright. I will maybe, I don't want to throw cold water by any stretch of the imagination, but I want to just remind everyone that healthcare moves slow. And with all of these advances, from everything from digital, right, like electronic health records, we're how many decades behind online banking or computer digitized banking. There's regulation to consider. There's patient impact to consider. All of these systems are interdependent, and because lives are at stake, people don't rush in. I am a believer that the digitally enabled, the AI enabled provider clinician system is going to outcompete the non-digitally enabled AI enabled provider clinician system. So I think that is the direction that we will move. But I do think it's going to happen in fits and starts. It's going to happen as the evidence and data accumulates. And what we're going to see, I think, especially with the advent of AI and large language models, is a lot of what we've seen with consumer wearables and the advent of digital tech. It might get consumerized before it gets medicalized, right? So with people coming in with their Apple Watch and Pat, with you walking in and showing your doctor, oh, this is what my Apple Watch says. I think it's soon going to be, this is what my, this was what ChatGTP had to say about my constellation of complaints, what they think might be going on. You've seen the New York Times and the Wall Street Journal articles that have already caught, rare cases and, examples of these large language models being able to solve difficult, New England Journal case reports and studies. So I think we as providers and clinicians have to be ready for what we're going to do when patients come to us with this information, this data, and these questions. And I think we need to do a good job of being open to it, because I think a lot of providers were burned when they shut down, when somebody brought them an Apple Watch alert or a wearable, flag about their health, only to have that patient then be turned off to that provider as opposed to being turned off to the technology, because they see it, they feel it, they understand sometimes these devices more than they do their physician, and certainly get more time with their device than they do with their physician or provider. So I think the better we can uptake, utilize, and really partner with these types of tools and technologies, the better off we're going to be.
And Chang.
So I think these are all very great points, and again, thank you for having me here. I think the partnering part resonates with me. So let's partner with technology. We're all excited about the future of health technology and digital health, and I think that's why we're all here. But just seeing that as not just as a data deluge, but as another partner, maybe AI partner, maybe data partner. But it helps us kind of like become the better interface really between patients and the technology. So I think that's important to keep in mind going forward. And as kind of the academic portion of things, all these new technologies will keep springing up, right? So there'll more and more tools to test, more and more things to evaluate. And I think it's going to be important for us to do our part in generating that clinically rigorous data so that they can be kind of more objectively evaluated, and hopefully help patients in the future.
And Lani.
Yeah, I think, what we at DTA want to see with digital therapeutics is that, even if it's in fits and starts, even if it's slow, that these technologies become a seamless part of the standard of care. And we know that it's going to take that clinical evidence that everyone has mentioned. It's going to take real world evidence and, outcomes data. It's going to take funding, as we've mentioned as well, right? We need to have these technologies reimbursed and paid for. And, the education piece cannot be understated. We have a lot of work to do in terms of educating clinicians, educating patients. And, AHA is doing a wonderful job as a partner in educating, as Lauren mentioned, and putting together modules that help with education for clinicians, education for, kind of patients at large. So we appreciate being able to contribute to that. And I would say that, in order to kind of move these things forward, partnerships, are hugely important. So if you're looking for ways to kind of amplify the message, DTA is here for you. AHA is here for you. DTA is partnering with the American Telemedicine Association for some, initiatives now because of the concern we have over, some of these modalities not moving forward. So, go to your trade associations, talk to your patient advocacy organizations to help amplify your message so that these technologies can become part of the standard of care for our patient journeys.
Excellent. Well, this was such an engaging conversation. I frankly forgot to look at the questions. There are a couple of questions in the chat. I'll read them if anybody wants to make a comment, but at least we'll have them for the recording. So the first one is Dr. Blood, you bring up a critical point on paradigm shift with integrating digital therapeutics and having resources in the clinic to be able to educate the patient on best use of the digital, as well as regular review of the incoming data, alert thresholds. Do you see that a clinical technologist could be added to the clinical team? I'm involved in clinical trials and suggest having a dedicated resource similar to Dr. Kim's comment.
Yeah, I think you have to be careful. I'll say right now, like adding FTEs to a clinic is challenging, and those support services are not always easy to to sell an ROI on, and health systems are reticent. I'll speak for our own. We're actually downsizing our non-patient facing clinical staff, even at the Mass General Brigham, which is unusual to say and experience, but I think we're seeing significant pressures, not only from indirect rate cuts and research pressures, but operational pressures that are making it tougher to have the margin. So I've seen models like that succeed. I know, Ochsner in New Orleans has what they call, I think they were O bars, where they literally had like what they kind of like Apple Genius bars, where they would help their patients get set up with CGMs and blood pressure monitors and scales and things like that to connect those digitally and have that data flow back. So I think, I've seen examples where that's been successful. I think it would be great. I will say the technology is slowly but surely getting to a point that it's more and more seamless. And while, there is, you always have to be conscious. I'm also looking at the next question of equity and making sure that we're not like worsening a digital divide or exacerbating inequities. I do think the, access to smartphones and the seamlessness through which we can connect a lot of these devices and technologies is making that specific level of tech handholding less necessary, which I think is a good thing. And I think that will continue to improve over time.
Great. Yeah. And so the final question, amazing panel. This was great. I want to focus on health equity and the challenges of digital therapeutics. For all the amazing abilities these technologies present to empower patients in prevention, they introduce significant opportunity to increase health inequities. Are there some unique approaches that the panelists can speak to? So any just concluding thoughts there, and then we'll wrap up.
Sure, I can jump in and say, that something I mentioned a moment ago is really thinking about partnering with patient advocacy groups. These groups are very focused on their specific disease or disorder state, and patient advocacy groups are also very focused on, including as many types of patients that are concerned about their particular condition as possible, and providing education in a way that's accessible to that type of patient, whether it's somebody who's, learning remotely because, they're geographically kind of out of a major metro, providing education that's culturally competent, that's, language appropriate, all of those sorts of things. So I think patient advocacy groups are an incredible way to bring the conversation about health technology to the patients in an equitable way. So I would say that's a thing to think about.
Great. Well, on that, I want to thank all of you for your time, your expertise, and look forward to continued dialogue and continue working with all of you on all of these amazing initiatives. So thank you very much and have a great day.
Thanks for having us. Take care.
Thank you. Thank you, everyone.
Thank you.